doctors. We have 3 sessions every day. The first session begins at 7:30 to 8:30, and that is our Hindi session. The second session is the international session in English from 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself on the YouTube, so that those who miss the session can watch it. You can share it with your friends without paying any money. And the purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Dr. Beatrix Gessner from Germany. She's a medical doctor since 36 years and specialized in dermatology, pediatrics, and general medicine, practicing homeopathy since last 32 years, running her own clinic since 29 years, giving seminars in Portugal since 10 years, and coordinator of IFBH in Germany. And she is always a big person coming over here and making a lot of presentation, particularly on dermatology. She had all the presentations were brilliant, and she had presented the 7 papers on the treatment of skin diseases. And today, Dr. will be talking about the homeopathic treatment for skin disorders part 2. Before that, as you all know, we are today is the death anniversary of Dr. Samuel Hahnemann. So we can more 1 minute silent prayer, a special prayer for our master. Thank you all. We are very happy to say that on this day we have Dr. Beatrix Gessner. So we proudly welcome you, and you can say a few words about Dr. Hahnemann before the session itself. Welcome,
Yes.
madam.
Yes, thank you so much, Dr. Danish. Always a pleasure. Thank you for the invitation, and good morning, good evening to everybody. And I also wanted to say today we have a special day. It's the day of the passing away of our great master. And it's now 182 years ago in Paris. So it's a bit difficult to express my feelings, but I think I can say that the huge homeopathic community worldwide, that we are very, very thankful for the great, great treasure Dr. Hahnemann left to us and left to this world. So in his name, we are continuing since nearly two centuries, his therapy and promoting this, and also IFPH is doing a lot for connecting the world in the name of homeopathy. So thank you for everybody being here together with us. Thank you for organizing these sessions since so many days. Thank you, Dr. Danesh, and all the other coordinators. So let us start with our presentation. I have a lot of cases for you. Okay, you can see the presentation?
Okay, it's fine, it's fine.
Okay. So today we have the topic homeopathic treatment of skin disorders, part 8. That means we already had some sessions together in the past. And today I also would like to try to explain or to show how we can see the principles of homeopathy in our patients. And let's talk about the skin, the function of the skin. The skin is the largest organ of the body, 1.5 until 2 square meters. And every 28 days, the cells of the epidermis are totally renewed. That means every 28 days, the whole epidermis is new. And it seems to be a very natural way, because 28 days we also know from the cycle of the moon. 28 days we also know from the cycle of the menstruation of the woman. So the skin is doing in the same way, And if there's any disturbance, like it is, for instance, accelerated, sometimes it's renewing every 5 days, that means the skin will become horny and we can get these dysfunctions like psoriasis. So I have two cases of psoriasis for you. Let's perhaps talk a bit about the pathophysiology of psoriasis. Is multifactorial, like very often the skin diseases. It's multifactorial, and it involves epidermal hyperproliferation, abnormal differentiation of epidermal keratinocytes, and inflammation with immunologic alterations in the skin. The hyperproliferation is characterized by increased DNA synthesis and a markedly decreased turnover rate for the epidermis. So we have different forms, morphogenetic forms of psoriasis. We have the psoriasis vulgaris, the normal, more common form. We also have a form, we have little spots on the skin, that's the psoriasis guttata. We also have psoriasis inversa, that means more the folds are affected, like the axillas or in the genital region, on close of the Riemanni. And we also have psoriasis capitis, which is involving the head. And there are a lot of remedies for psoriasis. And like this was a seminar of Dr. Parekh from India explaining how difficult it is to treat also psoriasis. He was telling us in the course, and he has also at the screen many remedies. So we have good remedies, and sometimes it's not so easy to choose the right one. So let us have the first case. This is a case of a teacher, 34 years old. He has skin eruptions since 1.5 years. In former times, he had a bit of dry skin around the eyes, but never had skin problems. Never had eczema, neurodermatitis, psoriasis, never. So it started late, and now since 1.5 years. His father also has psoriasis-like skin eruptions when he has stress. And his mother has a disbalance of the thyroid gland. So here we see some spots. Very typical is a round, coin-like eruption with white scales. Here you see it on the legs also, on the foot. And his history is like this. He does not have many complaints, but he's telling that there's a quite great psychological stress at school. He has 2 difficult classes. He's new as a teacher. His first classes now, they're difficult. And the contact with the colleagues, the other teachers, is not so good. He would like to have more an open exchange. And he expresses like this, reserved, like behind a curtain. He's new at that school, and this is in Switzerland, and he's German, and we have good connection with our neighbors in Switzerland. But the mentality can be a bit different, and he's not feeling so very well there. So on the physical plane, we have some symptoms of the bladder. He has been observing that he has to urinate quite often, more than before. And also his sleep, which always was very good, now in the last 2 years, he's waking up at night. And also he's feeling his heart a bit, and a tension in the region of the heart. So for him, since 4 years, he has a relationship with a young woman who is studying in England at the moment. They cannot meet very often, which also makes him sad. And normally he's a very open person who likes to travel a lot. So that's more or less a picture. And he's developing a really disturbing skin eruption. Working as a teacher, he cannot show this to his students, so he always has to have clothes with long leaves. And so the remedy was not so difficult. But what shall we give here now? It's a person with a psychological stress. He's more introverted as usual. The bladder is reacting, and the sleep is worse. So I decided to give Natrium muriaticum C200 in a single dose. 1 week later, the skin is reacting more. Psychologically, he's feeling better. So we can see in the organon paragraph or aphorism 253, Dr. Hahnemann is clearly talking about this, that even the skin was getting worse. He was feeling a bit better, more calm, more secure. So 1 week after giving the remedy, we don't like so much to have an aggravation, but as he is better psychologically, he can wait. Don't change the remedy here. That's very important. So you see the aggravation at the elbow, also scurvy. So wait and observe. 5 days later, the eruptions are still very active, but less itching. That's also a good news. So I had the feeling we are on the right way. And look, it is still quite active. So 12 days later, 24 days after taking the remedy, the skin now is getting better. So you see on the pictures, it's getting more smooth, less red. 6 weeks later, improving a lot. Improving here on the leg also. 4 weeks later, quite. These are still a bit skin which is not so colored because of the eruptions before, but the eruptions themselves vanished already. Look, everything is clean and he is happy. So, conclusion. As James Tyler Kent was telling us, wait with a single dose. So, if you give a C30 in chronic diseases and chronic skin diseases, we have to wait 4 weeks. And if we give a C200, we have to wait 6 weeks in a chronic case. And there can be a period of aggravation. After the C30, I see an aggravation mostly in the first 10 days. And after the C200, mostly can be directly or in the second or third week. So if we are treating the patient, giving the remedy C200, and he's getting better, and after 2 or 3 weeks he's getting worse again, we have perhaps the impulse to repeat the remedy or to change the remedy, and that is wrong at that moment. For this, I'm showing this case to you. Here we have to wait. So, very interesting was he was, during the aggravation of the skin, he was feeling emotionally better. Sometimes we see this. And after 12 weeks, everything is much better. It's summer, he went on holidays, traveling in Spain and Greece. Now back home with the cold weather again, he has some pustules on the elbow again. At school, everything is fine. He feels more relaxed, has a good connection with his colleagues. He really likes to travel. To come home always is a bit difficult. He always feels better at the sea and in the mountains. So now we are also at an interesting point. He really was good. Everything was gone. And now, some months later, coming back in a light form. Of course, we could have now the impulse to repeat the remedy, like C30 or LM potency. But if we ask ourselves, He is saying he's not introverted anymore. He feels more open and relaxed. His sleep is better. He's not complaining anymore about his bladder. He likes to travel, better at sea and mountains, better outside in summertime. So here I decided not to repeat Natrium muriaticum, but to give a nosode. And because he likes to travel so much, I decided to give tuberculinum LM3, 10 drops every day. So let's see what happens. 3 weeks later, he says it went better step by step for 10 days. Then it got worse. He stopped the remedy and now it's much better. 6 weeks later, despite of the winter time and the cold weather, the skin is much better. So conclusion. First, we had the constitutional remedy, which was connected with his life situation. To calm down the skin completely, also in winter time, he needed a nosode, in this case, tuberculinum. So the treatment of chronic skin diseases takes time. That is very important. Also to tell the patient. Okay, let's have our second case. And it's a case of psoriasis of the head, capitis. A 45 years old woman. Since 20 years, she has psoriasis of the scalp and pains in the left hip. She's vegetarian. You can see white crusts, sticky crusts on the head. It's itching a bit. The hair is falling, and she's a teacher. So this is also not so easy. Here on the other side of the head. Very thick and solid white crust on the scalp. Losing hair, a bit of itching. Okay, therapy. There are no special symptoms. So we are facing here a one-sided disease. And as Dr. Hahnemann was explaining in aphorism 173 in the organon, these conditions are not so easy to treat. So here we have a local disease and we need a local remedy. So which is a remedy which has a very special connection to the scalp? With crust, with white dandruff. This is Metzerium. So I gave Metzerium C200. And 4 weeks later, the dandruff is becoming better. Less pain in the hips. 8 weeks later, the scalp is much better. Hip joint is fine. So here, in this case, the homeopathic remedy was affecting the scalp, the skin, and also the joint. So it was also working on a constitutional base. Follow-up. During the following years, she normally needed 1 dose of Metzerium C200 during winter time. She contacted me in autumn when it was getting worse. She got the remedy, 1 dose, and was content with this. So, third case, 10-month-old boy. Here I will explain that sometimes if we don't find the right remedy at the first time, it can be a bit difficult, and we will have we will use different remedies until we find the right conclusion, hopefully. So here we have 4 months. No, we have a boy with 4 months. He had a vaccination with polio, HIV, DT polio. Short time later, he developed an eczema at the left arm where he had been vaccinated. So we have this boy, and this eczema is a bit special. It's not a normal allergic eczema, which you have normally at the bands or here around the neck or in the knees. He has these round eruptions. So eczema with red spots at the arms, face, and also band of knees. This is a very friendly child, likes a lot of attention, likes very much the skin contact with the mother. So I decided first to start with a constitutional remedy, and I gave phosphor C30 and later phosphor 200. And there were up and downs, but now after 2 months, the skin is worse again. So I decided to give 2 years C30 because of the vaccination. And there was a little aggravation for 3 days, better for 3 weeks, which was something, but now worse again. So I said to myself, now it's better to look for a nosode. And as phosphorus and tuberculinum are close, I decided to give tuberculinum C30. 10 days later, the mother is telling it was much better the first days, no worse again. So she was so hopeful, and now worse again. And now at the moment he has developed thin stools, loose stools. So I was repertorizing and I decided to give sulfur. But this also was not helping a lot. So the mother was really in despair. And so I said to myself, it seems to be that here we have a blockage. We are now 7 months after treatment. And I feel, honestly, it's important to show these cases. It's always nice to have a very excellent case and very good reaction, and we are happy to show the remedy with that condition. But in the daily routine, we also have this work and this challenge with our patients, getting a bit better, a relapse, getting a bit better, another relapse. So how to manage these cases, I feel that's also important to share within our colleagues. So I went to the repertoire of Murphy, skin eruptions after vaccination. Of course, we have Tuya, but we also have Silicea, Sarsaparilla in Metzerium. Skin itching at night, there we also have Metzerium. And rectum diarrhea in children is a big rubric, but we also have Metzerium. You can see here at the repertorization. So I gave Metzerium C30. 3 weeks later, much better, less itching, less diarrhea. 5 weeks later, very good. 8 weeks after a single dose of Metzerium C30. Now we feel we are on the right way. Now we have a clear reaction. It's getting better. It's no relapse anymore. It's more clear. And we see the pictures here. Now the mother is phoning me. He needs the next vaccination. So I said, no problem, we will wait. And 3 weeks after that vaccination, the skin is starting again. So we gave again Metzerium C30 and everything was fine. So here's a boy. Conclusions. Sometimes we need more time. The vaccination can act like a blockage. There are more remedies for that than Tuya. So after the right remedies, the recuperation is quick and with less waves. Interesting that the eczema started at the point of inoculation at the arm. That spot-like eruptions seem to be typical in Metzerium. Case 4, a 6-month-old boy with a terrible skin eruption. So this is a little patient of my colleagues, a pediatrician, and 7 weeks ago he also had a vaccination. A day later, he got strong biting behavior. And 1 week later, the first eruptions came, which later became moist. He went to the hospital, he was treated with antibiotics. Back home again, another aggravation. The homeopathic treatment of my colleague with Tuya, D6 and sulfur, D6, 3 times a day, causing a big aggravation. So now we saw the child. If you look at the family history, the mother has asthma bronchial polynosis. And during the pregnancy with this child, the skin eruptions, she had skin eruptions all over the body. That means the child itself is having something inside which is triggering also the skin of the mother. And the father has asthma. So we have the predisposition on the two lines, on the maternal and paternal line, which is a bit more difficult to treat. Symptoms. It started with an urticaria. And also interesting, this little baby has very cold hands. So if we go to the repertory, we have reactions from vaccination, eruption after vaccination, icy coldness of hands, and eruption skin crusty moist. We have sulfur, thuja, silicea, but we also have metzerium in the first place. Okay, I gave metzerium B12 3 times a day because it was a baby. I was not giving cysteine. And 10 days later, the skin is improving, the hands are warmer. And 3 weeks later, the eruptions are gone. The mother didn't come again to show me, and I could not make another photo, but the eruptions have been gone. So if we talk about metzerium, it's a great remedy. It's a remedy with a lot of indications. We have the skin, we have the membranes, we have the bones, we have the nerves, we have violent ailments and aggravation at night. Metzerium is also called the herbal mercury. The skin eruptions are itching violently. They are worse at night, worse warm, and often they show a yellow, moist discharge. Can be brownish hard crusts, and the skin eruptions are alternating with asthma. Metzerium is also known for neuralgic pains, pains in the face, in this case, beta worms. Neuralgic pains of the teeth at night, very famous for post-zoster neuralgias, and tearing pain at night in long bones. It's a syphilitic remedy. And in former times, it was also known for deafness after suppressed skin eruptions. So, case 5. Little girl with a burn of the skin. Case history. A 2-year-old girl, half a year ago, an accident with boiling water, was hospitalized to remove the crusts and developed fever. She received antibiotics, and since 2 months, the situation is stable but not improving. So what happened, it was like this. The mother was cooking a tea and had the hot water bowl of tea. She was crossing the room and got imbalance, and the hot water was pouring at the head of the child, the arm, and the leg. And they had to go to the university hospital. It was a very difficult situation, but the child got better, and now again starting an infection. And now they said after 2 months, we don't want to have another operation, remove all these crusts. And they were looking for an alternative treatment. At the moment, the child has no fever, but has thick crust with yellow discharge. Here we see the head more closely. Metzerium, here also I gave metzerium in LM potency in the beginning, 10 drops daily. Next day, the discharge was better for 3 days, and then it came back. So we went on, but later again more discharge. We stopped the remedy, and I gave C30. And 1 week later, the discharge was quite well, but now the child was developing fever. And as we did not want to give antibiotics again, we had to change now the remedy. So now we have to change our approach. Now we cannot go on just giving Metzereum, and the child is getting fever and infection. This is not possible. So now we had to look for a constitutional remedy, and we have that discharge. She also got some pustules on the body, hand and neck are more spetting. It's a small child, a lean child, and he has very good memory for details and picks up little things from the floor. So I decided to give Silicea C30 diluted twice a day. 3 days later, the fever was better, and now the hospital wants to operate a second time, and the parents refuse. So conclusion, here we have to stay with Silicea, and I gave a higher dose, C200. 10 days later, general health is good. The crusts are more dry, and we have less discharge. In the following months, she received Silicea C200 and Silicea 1M. And we have now a lot of pictures. So you see still a lot of dark crusts on the head. Luckily, they were not painful, and she never developed again fever. So with a grandmother here. So now you see the crusts are more centrating, more concentrating, and here also. Here much better. With the father. So 5 months later, control in the hospital. They want to remove the crust now, which the parents again refuse. So situation is getting better, but still not resolving totally. In the following weeks, the situation was stable, but not improving anymore with Silicea. So what shall we do now? Change the remedy. We have localized disorder. So I too choose also a localized remedy, which again was Metzereum, C200. And also Dr. Hahnemann explained in of aphorism 173 about one-sided diseases that sometimes we only have a few symptoms and we have to prescribe on these symptoms. So again, Metzereum, C200. 2 months later, there was a short and strong discharge. And now it is much better. After 1 dose of Metzereum C200, not repeating anything. Here now everything is gone. Of course, the area where the hair did fall will not recover. But it's not inflamed anymore, no crusts anymore. And now she's a beautiful young woman and can cover that part of her head. It's not a problem for her. Okay, conclusion. Here we had a one-sided disease. We did give a local remedy. Afterwards, a constitutional remedy. Then the local remedy again. And Silicea is also very strong for pustules and discharging skin affections. Conclusion. In the treatment of skin disorders, we need patience and stability. No quick changes of the remedies. Conclusion. Homeopathy is an art of healing. It works and it cures. Thank you for your attention. So, I say greetings to my friends from Latin America.
Yes.
Nice to see you.
Thank you.
See you. Thank you.
Thank you. Thank you, Dr. Beatrix, for such a magnificent uh, presentation in this evening. And as we all know that today is the death anniversary of Dr. Samuel Hahnemann, our master. And on this great day, we are lucky to have such a nice presentation from a person like Beatrix Gessner from Germany itself. So it is a time for discussion, and those who want to participate in discussion may raise your hand so that we will allow you to unmute yourself and you can speak. And as we all know that the skin conditions are very difficult to treat, but if you are one should say to oneself that I am a homeopath and not a person, not any other system of medicine, because the treatment methodology is entirely different. After giving the first dose of medicine, you will have to wait for some time. What are the changes happening in the mind of the patient? Maybe the mind of the person is improving, his mental symptoms, mental activities, all will be improved. And so if that gives a positive indication, then you wait there. Your medicine has started working. And once the medicine starts working, definitely it will do it's a wonderful job of curing the patient, that we can say the only homeopathic medicine can do that. Anyway, that kind of presentation, all the cases shown were brilliant, as we all know that Dr. Beatrice has just relay on her knowledge in materia medica, as well as the knowledge and repertoire also. That's why she was able to observe certain symptoms in a patient. She's a close observer of a person. What the patient is doing in front of you, what the patient is showing in front of you, and what the patient is thinking about the disease, and all those things. It is the it is the confidence in the face of the doctor itself will definitely give the confidence in the patient also. That's what Dr. Beatrice is always doing. She is a very firm believer of Dr. Hahnemann's homeopathy. That's why she is taking out on homeopathy for the last 32 years, even though she is a medical doctor from mother side. So congratulations once again. Dr. Gusto has raised the hand. Yes, doctor, you can speak now. You can ask a question as well as you can say something on the presentation also.
Good morning from here to everyone. Very good cases, the pictures wonderful, and the idea it's good explained. Just to introduce you that Hahnemann also makes in the paragraph 221 and 22 that when the works of the first remedy is ended with the local symptom, you must, as you notice and you give it in your conference, you must find the constitutional remedy. That is just to give you another paragraph or work on it, but the idea is that you must begin with the symptoms that you have from the patient. When these symptoms disappear or the aggravation appears, you must look for another remedy, not to increase the dynamization. Change the remedy, as you do it very well, very clear the cases. Thank you very much. An excellent presentation. Thank you, Beatriz.
Thank you very much, Gustavo. You know, Dr. Danish, Dr. Gustavo and Dr. Sandra, we have meeting in Buenos Aires several times,
Yes.
working on the organon. He's a specialist on the organon, and we had a lot of inspiration together. It was really, really great. I
Yes.
appreciate it.
Yes, we are lucky to have such wonderful persons in this forum, and you are, yes, sir, you need to come over here and make some more presentation in the future, because
Okay.
the kind of presentations are very, very important, because people don't even believe that homeopathy is nowhere in any part of the world other than India, but or in India, Pakistan. But we can show the world that homeopathy is everywhere around the world. We have doctors and even practitioners around the world doing excellent job, and that's what our contribution to homeopathy, because you people are doing excellent job in your part of the world also. As Dr. Gessner has rightly pointed out, the knowledge of organon is very important in treating. The Hahnemann has all those thought behind him when he wrote such a big book, a small book, I may say, but full of content. That is Organon of Medicine. And if you go through each and every line, you will get something and different that you were thinking in the past. Anyway, if any,
Thank you very much.
yes, sir.
Thank you.
Dr. Sandra, you want to speak? You can speak in your language, and Dr. Beatrix will be able to translate if you are not speaking in English.
Good.
Or Dr. Gessner Pereira can do that also. You can speak in your language.
Buenos días a todos, la verdad que muy contenta con la presentación y la claridad con la que fuiste moviéndote entre un caso y otro, entre los remedios y teniendo la doctrina en tu cabeza y con la inteligencia de la doctrina y lo que enseñó Hahnemann te moviste perfectamente. Eso quería decir. Gracias.
Gracias, gracias. Dr. Sandra was saying that she liked very much that we could see the doctrine of Dr. Hahnemann in our cases. And it was very clear, and how to choose the remedies, and also how to use the potencies in which continuation. And yes, that was the idea of this presentation, to show the organon with our patients. Yeah.
Yes, exactly.
Yes.
Thank you. Thank you. Thank you, Dr. Sandra. And now it is Dr. Sabri Castillo.
Gracias, doctor Danish, un gusto. En este día que celebramos a Hahnemann, el día que partió Hahnemann, nos ha dado una gran lección nuestra querida amiga Beatrix, ¿ya? Muy clara, muy interesante, y que nos demuestra que la doctrina está muy unida a la práctica. Eso es lo más importante.
Sí,
Eso nomás.
Very good. Thank you very much, Sergio. Dr. Sergio is saying it's so important to see that the doctrina is so close to the practice. We like to have that. But of course, not all the cases are like this. Sometimes we are struggling more. And perhaps also to add a certain information, if I treat allergic eczema, I had many sessions on that topic, as Dr. Danish knows. I use more LM potencies. It's much more easy for me. And also in South America, Buenos Aires, they use a lot of LM potencies. But with that kind of one-sided diseases, like the crust on the head, or with the psoriasis, it seems to me it's more easy to have a C potency and wait.
Okay. And now it's up to Dr. Ruth Dutchman and to add something more here. Yes, please unmute yourself and you can speak. Please unmute. You can speak right now.
Hola,
Hola, Ruth.
¿qué tal? Bueno, buen día.
Buen día.
Bueno, felicitaciones, excelentes los casos. Es muy difícil para mí siempre tratar casos de dermatología por sus características, así que bueno, aprendo un montón. con estos casos que presentaste ahora y que has presentado antes. Y tenemos una paciente en común que le fue muy bien y no volvió, pero le fue muy bien por suerte. Así que bueno, te agradezco siempre por tu generosidad, Beatrix. La verdad que sí. Siempre muy
Gracias,
generosa con
gracias,
todos tus
Simon.
conocimientos.
Yes. So Dr. Ruth was saying she's also a teacher in Buenos Aires in Argentina. And she was saying it's sometimes not so easy to treat skin diseases, skin conditions. Also, Dr. Danish was saying this. And always we can learn a lot with the pictures also and with the cases. And we also have a common case of a patient which was also, it was a difficult case, Ruth. It was a nurse, it's a friend of yours living in United States as a nurse with a strong eczema at the hands. So difficult, could not work again with the gloves, everything so difficult. And and we had some symptoms in different directions and also psychological symptoms. And at the end, I was nearly a bit embarrassed to propose to give sulfur because it was in the hospital and always the toxins were creating difficulties at the hands. So on the psychological level, she was not sulfur and nothing. It was, we are thinking about more about lachesis, other remedies. Huh? But at the end, sulfur was the solution. And
Sí,
she's
sí, sí. Anduvo muy bien y mucho mejor también del aspecto mental. Y bueno, después sí, sí, también le sacó el foco al problema y está abriendo la cabeza hacia otras cosas y ya no está obsesiva con el tema de las manos y puede trabajar y puede tocar, porque es instrumentista, no sé cómo se dice, pero bueno, es instrumentadora y usa guantes todo el tiempo y eso le angustiaba mucho, pero ahora está sin dolor, casi sin lesiones, así que está muy bien.
también con LM potencies, huh? Potencias,
Sí.
sí. So Dr. Hood is saying that patient, it was a very, let's say, a situation really sad also because she has to earn money. She has her children. And in a certain way, she could not go on. And now with the sulfur LM potency, she's able to work again, has less allergies, and also the mind is opening, she says. She's also on the mental plane, she seems to be a bit better. Yes.
It's exactly that. Exactly, that's what we need to look into. When a patient come after taking your medicines and then saying that, doctor, I have no relief to my symptom. You can see this and that. But anyway, when you ask about how you sleep, oh, I am having very good sleep and I am having a very good hunger and my stools and everything are quite normal. I am taking a lot of water. I am doing. I am started walking. So these are the indications of the right remedy. Not you just concentrate on the particular eczema and see, oh, it is getting worsening day by day. Doctor, what I can do, whether I shall apply some external applicants or not, like that, they may question. But in the meantime, you can teach the patient that, oh, your all other symptoms are that your mental well-being and everything is improving. So naturally, your disease will be cured within a span of 2 months or 3 months, like that. We can even predict how much time it may take. But in chronic diseases, we cannot say how much time because it need a lot of time. Sometimes there may be some obstacles like food and everything. But food is not at all not the only cause. But sometimes food may be the obstacle. And sometimes people may say that, oh, these skin conditions are because of unhygienic living. No, there are people who are living in a very highly educated. There are people who are very highly educated and living in a very high standard of life, but still having this problem. So we cannot say that it is not because of the unhygienic way, but unhygienic way of life can lead to this kind of disease, but it is not the only cause. Am I right, Dr. Beatrice?
Yes, you are very right. And here in Germany, we have good hygienic conditions, but we have a lot of skin problems here, a lot of allergic problems. And another topic also, Dr. Danesh, is not suppressing with homeopathic treatments. That's also not so easy. If we have skin eruptions, never give always sulfur, sulfur, sulfur. We can suppress. And so we have to be careful in the beginning. That we don't see any, after the treatment of the skin, we don't see any problems of the lungs or bronchus or shifting of the level.
Is when one is under treatment of skin, it is better to take a large quantity of water as well as a very good amount of fruits and vegetables, as well as you can take fish also. But fish, what's your opinion on that, Dr. Beatrice?
Mm-hmm. What was the question about the nutrition?
Yes, we used to say that it is better when you are under the treatment of for some skin conditions. You may ask the patient to take as much large intake to take a large quantity of water, as well as
Yes,
fresh fruits, as well as vegetables, and sometimes you can advise some kind of fishes for better recovery. And
yes,
exposure to sunlight is also a very good thing. But so there are a lot of people who are having vitamin D3 deficiency in those conditions. How can you manage the cases? This is what my question.
yes. So the nutrition is always a main part of the therapy, and perhaps not so much with psoriasis. In that case, no, not so much, but with allergic eczema, yes. And you know, sometimes the allergic tests, they are not very, especially if in the little children, they are not so reliable. So we have
Yes.
to, yeah, we have to see and to look. So if you have a child, a little child eating something, and after a short while has a red face around the mouth, we know this was not good. Okay, but we have to try and to find out. And um, normally we say here in Germany, no sugar, no cow milk, and now no wheat. We say this here. And try to give another form of vegetarian milk, give other products. But the aim, the idea is that after some time, the child can go on to eat more or less normally. Also eggs. Eggs can be also a big problem.
Yes, what I have noted is that when you take the egg of this duck, it's good for skin condition, and but in the meantime, the egg of chicken will do entirely different job. It may sometimes most of the skin condition may get worse, even though
Ah,
if you take the chicken meat, it may not do much damage, but the egg of chicken is definitely doing a lot of damage to the patient or skin condition. Sometimes it may was. I have seen several times that so I used to ask the patient whether you taking whenever there is some obstacle. We keep seeing that there is an obstacle in the way of cure. Then I used to advise better not to take this kind of egg. You may take the egg of duck.
yes.
That will not that's a good thing I have learned from my practice. And
Yes, I agree totally, Dr. Danish. The eggs are also important, and sometimes the child is eating a little cake, and there's a bit of egg in the cake, and it causes a problem.
exactly. So I'm inviting Dr. Uh, Rambaresh sir to say a few words. Please unmute yourself.
Thank you, Dr. Dhanesh ji, everyone. Namaskar, good night, good morning, good evening. Heartfelt congratulations, Dr. Beatrix. Very nice presentation, excellent session. Excellent session. Skin eruption. Skin eruption is a very difficult homeopathic treatment. Homeopathic treatment, curative way of treatment is skin eruption. Skin eruption, suppression, other, and sulfur is a good remedy. And all presentation, case presentation, very good select remedy. Majornum due to vaccination. And sulfur all rounder. Sulfur is the mother of all diseases. Sulfur is called name of itching. Psoriatic patient itching.
Itching, yes.
Itching and internal itching. Thinking is called name is sulfur. Negative thinking. Negative thinking, vital force, internal to external. External produce eruption. So very good, very nice presentation. Very thanks.
Thank you,
Thank
Dr.
you.
Susan. Now I invite Dr. Augusto Pereira to say vote of thanks to the session, sir. Dr. Augusto Pereira, sir, you can say vote of thanks to the session and to Dr. Beatrix. Can you hear me, sir?
Gustavo, Dr. Danish, diz que talvez podes dizer algumas palavras, word of thanks.
Okay.
Okay.
First, you hear me now?
Yes, sir.
Yes, very good.
Well, first for the excellent presentation of Beatriz, but this day is very important for us because it's the day who Hahnemann has died in the morning of the second day of July. In some cultures, we prefer to celebrate the day which the person died because it remembers us all the work he has done during his life. That is very important for some cultures to put this day, as I think that for Hahnemann, it's a greatest man, and we have to celebrate his life because he gave us a big treasures for all of us.
Pleasure.
Okay, that is my thinking about this day. Yes. Thank you very much of this space.
Thank you, Dr. Augusto Pereira and Dr. Beatrix Gessner for such a beautiful session. And thanks for those who attend the session in this evening on a specific day. As we all know, it is the day of death of Dr. Samuel Hahnemann. So it is the death anniversary day. We are happy to have such people coming together, doctors and from different parts of the world joining the session and discussing about homeopathy as well as Dr. Hahnemann's contributions. Thank you all once again. And tomorrow we will have a presentation from Dr. V.K. Karunagar, and he will be talking about practical difficulties in implementation of case-taking guidelines and its impact on cure in homeopathy part 2. Dr. Beatrice, you can conclude the session.
Yes, thank you very much. And always a pleasure to see you. And we have a good connection with our hearts. That's so nice. Yes.
Thank you all. Good night. It's
Good night.
over to Dr. Shaila P. Shaila to moderate the Malayalam session.